Today we're going to focus on metals as an agent of environmental contamination, and we'll also learn about some of the health effects exposure to these metals can cause. This discussion is divided into two sections because it was a long presentation. So the first section is going to focus broadly on different effects of metals, and the second will talk about specific metals. By the end of this chapter and the presentation, you should be able to name at least 5 heavy metals that are hazards to humans, describe how people might be exposed to metals, distinguish between the role of essential and toxic levels of trace metals, think about occupational settings in which workers are exposed to metals, and discuss ways we can prevent exposure to metals. Toxic metals include heavy metals like lead, mercury, or nickel, and metallic compounds that include aluminum, iron, or tin. These metals are featured in the Comprehensive Environmental Response, Compensation, and Liability Act, also known as CERCLA or Superfund. It has a priority list of hazardous substances, and metals are one of the top hazardous substances we're concerned about in the United States. Heavy metals have a high atomic weight that exceed the specific, and its specific gravity exceeds that of water by 5 times or more. So literally, they're heavy, but it also means they can wreak havoc in the body. Some of the toxic effects of metals include metals that cause multiple effects, some metals that are essential for the body to function but have potentially to be toxic. Metals can be used for medical therapy, and then there are some minor toxic metals that we aren't going to spend a lot of time discussing. Bioaccumulation is an important concept when we're thinking about chemicals in the environment. Metals have the opportunity to become more concentrated and harmful as they move up the food chain. And this can get concentrated so that the predators at the top of the food chain, let's say it's humans, can get higher doses. A good example of a concentration or a bioaccumulation of metals is mercury in fish. There are many ways that we can be exposed to metals. Inhalation exposure through the lungs occurs when you inhale dust, metal fumes, or vapors. Through dermal contact with dusts or on the skin, and we can also ingest metals, either in food or water or in soil or dusts. Contact with high concentrations of metals is most likely to occur in occupational settings where people are working with metals. Welders often work with different types of metals, zinc as in one example, and they can be exposed to high types of metals, high concentrations of metals. Other people that work in plating industry, if you're plating metal plating, can be exposed to metals like chromium. Lower levels of exposure, what we might typically see in the environment, occurs with ambient environmental contamination. Metals in paint that children ingest, metals in soil that kids ingest, metals in soil that the soil gets kicked up into the air and you ingest. And of course, we've seen both high and low level exposure via drinking water in places like Flint, Michigan. Acute symptoms happen rapidly from a few minutes to 1 hour, and depending on how the metal was taken into the body, it can cause vomiting, headaches, or even severe outcomes like convulsions or not normal breathing. Long-term exposure is often difficult to distinguish from other medical conditions. One major example of long-term exposure is learning impairment or reduced cognitive function, and that can happen in young children very quickly, but at low levels. As I mentioned, there are lots of ways that we can take the metals into our body, all the different routes, inhalation, ingestion, or dermal contact, And the environmental component of that is what environmental media or medium, be it air, water, soil, or food, are we coming into contact that has that metal in it? We have identified that gender reacts differently to metals. The health effects of exposure to heavy metals are different for women than they are for men. And this may be related to hormonal and metabolic processes, as well as things like pregnancy and menopause. Children, infants, fetuses are overwhelmingly susceptible to heavy metals. These toxic metals pose the largest risk to children, especially because after exposure, their impairment can be lifelong. There can be physical and mental developmental damage, damage to internal organs and the nervous system. Some forms of cancer are associated with exposure to metals, and in severe cases, mortality. Children demonstrate nervous system damage when exposed to certain metals through memory impairment, difficulty in learning, and behavioral problems. Hyperactivity syndrome and overt aggressiveness have been linked to exposures to metals such as lead. And because a child weighs less than an adult, if an adult and a child had the same amount of drinking water with lead in it, or the same amount of dust that they inhaled with lead in it, or paint chips that they got exposed to, the child's dose would be higher. So they're consequently overexposed to heavy metals in food or in water when we're talking about the same amount consumed by an adult versus a child. As I mentioned before, fetus is very susceptible to exposure to metals. Lead and mercury can cross the placenta and cause fetal brain damage. And that's why the very vulnerable populations, including in utero, have to be protected from environmental exposures.